New York will soon begin accepting out-of-state medical marijuana licenses. It's all part of a bill recently signed by Governor Kathy Hochul that would make it easier for in-state and out-of-state patients to access the care they need. Dr. June Chin is the Chief Medical Officer with New York State's Office of Cannabis Management.
New York is committed to protecting the medical program long term, even as adult use expands.
Under the new bill, all medical marijuana patients can expect expanded access, modernized patient rights, and more clear rules for care. Out-of-state medical patients will soon be able to make purchases at New York dispensaries. Dr. Chin says that change is essential for patients visiting leading cancer centers like Memorial Sloan Kettering. It means patients will receive continuous care without having their care interrupted.
This brings New York in line with other strong medical cannabis states and does acknowledge that medical needs do not pause at the state borders.
In-state patients can expect medical marijuana cards to be valid longer, up to 2 years. Chin says it helps patients with chronic or lifelong conditions.
Sometimes that burden of frequent renewals can get to a patient. Sometimes they can't get to the doctor in time. Sometimes it's out-of-network costs, for example.
The new law also addressing cultivation.
So sometimes, if you're taking care of someone, that person might not be able to take care of growing their own plants. So if you have a caregiver, they can grow for you.
Cultivation is expanding to patients 18 years and older. Chin says it's especially helpful in rural communities where cannabis products may be inaccessible or unaffordable.
It gives them more agency for plant-based medicine.
Chin sharing a message to doctors who are still hesitant to discuss cannabis care.
Avoiding the medical cannabis conversation does not protect patients. It pushes them to unregulated advice. So you don't need to be a cannabis expert. You just need to be willing to discuss it and refer when appropriate.
The law goes into effect in 90 days. However, Dr. Chin says each change will roll out at different times. She says OCM will be sending out public notices when those changes take effect. Reporting in studio, Karina Dominguez, News 10 ABC.